Hi, my name is Amir Safavi, and I'm a second-year radiation oncology resident at the University of Toronto. Thank you for the opportunity to present our work at the ROECSG Symposium. CBD is the Canadian Royal College's adaptation of competency-based medical education for residency training. CBD encourages residents to frequently request low-stakes assessments and requires faculty to deliver narrative, actionable, and timely verbal and written feedback. Competence is demonstrated by completing specific tasks called entrustable professional activities, or EPAs, which consist of discrete observable skills called milestones. The majority of Canadian radiation oncology programs implemented CBD in July 2019. The purpose of our study was to conduct an institutional pilot of CBD prior to the national transition and to characterize EPA assessment completion and resident and faculty perspectives on implementation challenges. We conducted a mixed method study involving resident and staff participants who participated in a 4-week pilot completing EPA assessments. All participants were asked to complete a post-pilot survey, and residents were invited to participate in semi-structured focus group interviews. Completed assessments were quantitatively and qualitatively assessed. Descriptive statistics were calculated from the survey responses. Focus group interviews were audio recorded, transcribed, and coded for theory generation. 4 EPAs were assessed in this pilot, spanning activities from history taking through managing on-treatment issues and follow-up care. Almost all eligible residents and staff agreed to participate in this study. Post-pilot surveys were completed by 4 of 6 residents and 5 of 7 staff. All residents had documented assessments and participated in the focus groups. Assessments were requested and documented on a weekly basis. The average number of documented assessments submitted per resident was approximately 4 during the month-long block. Narrative comments were found in 68% of assessments. Of the documented assessments containing narrative comments, 27% described specific examples of observed competence or recommendations for improvement. 3 themes emerged about perceived implementation challenges. 1, direct observation is the most challenging aspect of CBD to implement. 2, feedback content and delivery can be improved. And 3, staff attitude, clinical workflow, and inaccessibility of assessment forms are the primary barriers to completing assessments. Participants believe that direct observation is best suited for time-efficient clinical activities. Activities with a normalized culture of direct observation, such as gynecologic exams and nasopharyngoscopy, are most compatible with EPA assessments. Some of the EPAs are easy to do and already built into how we work in clinic together, but when they wouldn't normally intend on observing, having to observe makes them see an extra patient with a longer amount of time. There was a common belief that the specificity and actionability of feedback were unchanged during the CBD pilot, compared to during the pre-existing model. This may have led to a discordance between the feedback expected in CBD by the Royal College and that which is delivered, as 3 of 4 resident survey respondents reported not receiving feedback on the majority of communication milestones. The lack of change in feedback content may be a consequence of the difficulty of integrating increased direct observation to inform the feedback. Residents were concerned about staff attitude towards CBD and its impacts on clinical workflow. Some were worried about requesting assessments at inopportune times and having staff be annoyed by that. I was definitely worried about the time doing assessment takes and the effect on clinical workflow. I already sometimes worry that I am slowing down my staff's clinic. You don't want to make them stay later. The inaccessibility of online assessment forms was also cited as a barrier to assessment completion. In conclusion, CBD assessments were completed regularly during a block-long pilot. Implementation challenges include improving feedback quality, promoting direct observation, and continuing faculty development. Further studies required to identify best practices and expectations for RO in the era of CBD.